Hello everyone, welcome to Mind Body Care, and this is Dr. Sita with you, and this is Keerthi, one of my clients. Keerthi and her husband are here in our hospital for the past 15 days. Keerthi wants to share her journey of struggle and success with all of you in order to create awareness about this condition called vaginismus and about unconsummated marriage. Please tell us all a little about yourself, Keerthi.
Okay, ma'am. So, hi, this is Keerthi. I'm from Bangalore. I'm 30 years of age, and my husband is 34 years of age. We got married in the year 2018, and it's been 5 years right now.
What is it that brought you here to our hospital?
Okay. We had a very happy married life. But in terms of the sexual relationship, we had faced a lot of issues. We were unable to consummate the marriage. We were unable to have intercourse.
So we would like to hear from you about the treatment that you took from other places before you came here. I'm sure you will be able to enlighten us about that.
Yes, ma'am. Sure.
So I'll ask a few questions. You please answer. Okay.
Sure, ma'am.
So Keerthi, you said that you faced difficulties while trying to have penetrative sex. What was the difficulty that you faced?
I had a fear and anxiety. It is very painful. So we enjoyed the foreplay, but when we went into this intercourse, what happened is like my thigh muscles gets tightened up, and when my husband comes near, I just my bum area, it just gets lifted up, and I push my husband from the bed. This was the major difficulty I faced.
Or did you consult a doctor, or did you try to solve it yourself?
So frankly telling, we thought it can be overcome from our end. So we wasted 2 years of time, ma'am. And then like we were getting all questions from all our relatives and society asking, is there any good news? It's been 2 years.
Okay.
And then we decided it's already late. So let's go and consult a doctor. So in the year 2020, we went and consulted a gynecologist.
Oh, that must have been during the corona time, no?
Yes, ma'am. So I had certain period issues. So I consulted the doctor and told all my history. So simultaneously, I told the difficulties what I'm facing while trying to have penetrative sex. So ma'am told me I'm taking unnecessary tensions. So she just told me just relax and try. You can definitely do it in a very good manner.
Okay.
And then since I had period issues, so pelvic scan was done, and then it was diagnosed that I have PCOS. Okay. So ma'am told let's begin with the treatment, and medicines were given for me for the PCOS condition.
So this condition, that is your inability to have penetrative sex, was not addressed properly.
Yeah.
Did you feel that?
Yeah, I felt, ma'am, because I tried to convey the message, what kind of issues I was facing. But since doctor found out that PCOS is the issue, ma'am, she just went ahead with the PCOS treatment. For 1 year, we took the treatment, ma'am.
And during this time, were you able to enjoy non-penetrative sexual activities like foreplay, etc., or did you shy of it and did you stop doing it because you were not able to do penetrative sex?
Frankly saying, we were enjoying it, but then gradually it's completely stopped because we were feeling we are not able to consummate the marriage. So we were completely broken, ma'am. So we were not able to enjoy the foreplay also.
Okay. So gradually the frequency and duration of foreplay also stopped.
Yeah, completely it got shattered.
This is what happens with many couples, In the initial year or two, they would be enjoying the foreplay even if penetrative sex has not occurred. Slowly what happens is they have a sense of failure. Still you waited for 1 year before going to another doctor.
Yes, ma'am. We waited.
Okay. And then?
And then we again we went and consulted a gynecologist. I just told the doctor I badly need a baby and I wanted my issue, whatever is the issue. I was not aware what is that particular problem I was facing.
You were not aware that it's a condition called vaginismus?
No, ma'am. I was not aware of it.
Okay.
So I told madam. So she told first we will do a physical examination. So I told okay. And then a doctor tried to do the examination.
By physical examination, you mean internal examination?
Yeah, internal. Yes, ma'am. Internal examination.
Okay.
So when the doctor tried to do the internal examination, I was very scared. So I could not cooperate. So the doctor scolded me very badly. First thing what she told me was like, it's better you cooperate. If not, you better get divorced.
Oh.
She told me like that, so I was completely broken that time. And then she told me like, I have 3 options. She told me, one is like, I can send you for a counseling to a psychiatrist. So they will help you. But the thing is like, if I send you to a psychiatrist, they will label you as a mentally ill person or a mental illness girl who's having mental issues. That was the one thing she told me. And the rest 2 things she told was like, you have to cooperate. If not, that is not happening. we can go ahead with the surgery known as hymenectomy. I was completely shattered, ma'am. I didn't reply anything to the doctor. I kept quiet. I just came out. And my husband was sitting outside. So I just told him, come, let's go home. And I was like totally crying and going back home. I went home and I explained to my husband, these are the things I've experienced from the doctor. So henceforth, please don't, force me to come to any doctor.
Okay.
And then
So sad
stopped,
that
ma'am.
such a thing happened.
Yeah, that was very painful. So it's because I had so much of hope, ma'am. I never expected a doctor would say such kind of things, harsh things to me.
Many couples do experience such things, Many
Yeah.
couples who have come to me with vaginismus, they have told me similar stories.
The kind of confidence I had within me, ma'am, it completely, dropped down. And I was not able to go to any other doctor also. That's the major impact which I was facing.
Then when did you go to another doctor after that?
I can tell even it took more like a year time, ma'am, because in between I had certain issues. I got this depression and then lots of mood swings that also affected our relationship.
Okay, that is in areas other than sexual life.
Yeah. Apart from that, there were so much of conflict between me and my husband. I used to literally cry, go in front of mirror and cry. So I was not knowing what was happening with me. So it's all that kind of trauma, ma'am. Whatever experience I got from that doctor, it's completely, it's stored in my subconscious mind. So that was very difficult and very painful.
Okay, so you went to another doctor after 1 or 2 years?
After 1 year we had been,
Okay.
ma'am. So that was also a gynecologist.
Okay,
So
that's also in Bangalore.
Bangalore only.
Okay.
So we went to a doctor and I told first when I consulted, I was not able to speak, ma'am. So I told the previous experience to this doctor. This doctor was very helpful in the sense she was so caring, and she told me first she made me relax, ma'am, and then she told me I need to do a vaginal examination. She told me I will not hurt you. And then she spoke to me, ma'am, and with the finger she did the examination. And I cooperated. So I was feeling better that time. The doctor was very polite. So I felt very happy. And I told, ma'am, these are the issues. So she told me there is no problem. There is no structural issue when physical examination was done in the vagina. She just told me that it's a psychological factor. So she told me, I can refer you to a psychiatrist. He can definitely help you out. And she told me about the dilators, ma'am. She told me you can use the dilators. It will help you to reduce the fear. Then we went to the psychiatrist and we spoke to the doctor. So I told doctor all the things. And I had seen a short video of doctor. So doctor, we were just talking with a lot of communication. Doctor told me it's a condition called vaginismus.
Okay. Oh, that's when you heard the term vaginismus for the first time, I suppose.
Yeah. Only then I realized, okay, this is a condition which I'm going through. And then doctor helped us a lot. He told me what kind of treatment to be taken, which will be very effective. So he told me counseling.
So what was the treatment that you got from that doctor?
Doctor told me we need counseling will be given. He helped me to explore, ma'am. He just showed the anatomy
of the vagina and vulval area.
Yeah, vulvar area. And then he told me you need to do Kegel exercises. Some breathing techniques were taught, ma'am. Diaphragmatic breathing techniques were taught. And doctor told me you have to do self-fingering to explore your vagina.
You were able to insert your fingers and your dilators also
yes,
regularly.
Regularly I was able to do. I had
good.
I was a bit anxious. A small tablet was given, ma'am. That's it.
So how long did you continue with the fingering and dilator therapy?
That I think we had almost 6 sessions, ma'am. So within 3 weeks we have to go for the follow-up. So I continued it, ma'am. I think hardly 4 to 5 months. I continued with the treatment.
So for 4 to 5 months you were doing self-fingering and insertion of dilators.
Yeah, that was successful.
Any partner fingering or anything was taught to you?
No, that was not taught, and I was not able to do that. Fear I had, ma'am. Only self I was able to.
So did your partner try to do fingering, and was he successful? Or
he tried, but that time also I had this.
You had this fear.
Yeah, fear.
Okay. Oh, so in spite of being able to do self-fingering, in spite of being able to insert the dilators, you were not able to allow partner fingering.
Correct, ma'am. Yeah, correct.
Even after 6 months of counseling and
yes.
other sessions.
Yeah, correct.
Right. Okay. Then what happened?
And then we could not continue the treatment, unfortunately.
So why? What happened?
The reason being I was diagnosed with IBS.
Okay. Irritable bowel syndrome. Okay.
So we just contacted our doctor and informed, sir, this is the issue which I'm facing right now. So he told me not to worry. He told once everything is done, you take the treatment and you can come back to me. That's it, ma'am.
So when did this all happen?
This all happened in the year 2023.
Okay. In the beginning of 2023 or towards the end of
In the beginning, ma'am.
2023?
In the beginning.
In the beginning.
In the
Okay,
beginning.
fine.
Yeah.
So how long did the treatment for IBS continue?
That continued almost 6 months. Again, it got extended, ma'am, because certain time it fluctuates a lot. I had a lot of mood swings and
Yeah.
all.
Then what happened?
After that, we decided, me and my husband decided, now we have understood what is the condition we are going through. So we decided this is not working, because when you take online consultation, regularly I'm not able to do the exercise and all.
Exercise at all.
So we decided we will find out a solution. So we started checking about the hospitals wherein we can take the admission and take the treatment. And then we found out that this hospital provides a treatment and there is so much of result. Every couple who come here with this problem is treated well and they're very happy. So we decided,
I
why not?
presume you watched Ajesh and Kartika's video,
Yeah.
right?
Yes, ma'am. I've watched it, and that gave me so much of confidence, ma'am. Because when we are very down, people like us, when they share their story, it's very helpful.
Okay. If I remember correctly, your first consultation was in the month of December 2023.
Yes, ma'am.
Yes?
Yeah, December 1st, we got the consultation, ma'am. Then we spoke to you. So I hope you're aware that I was completely broken
Yeah,
and
yeah.
I was
She was
depressed.
very depressed. Not the Keerthi which we see now.
So since I already had the depression, you started with the medicines, and since we are coming for this treatment, just to prepare our body, you had given all the supplements, which helped us a lot, ma'am.
And I think talking to that couple from Kasargod also helped a lot.
Yeah, that helped a lot, ma'am.
What we do is, whenever any new patient takes consultation for unconsummated marriage or vaginismus, we give the contact details of one or two of the couples who have come here previously for similar treatment. So talking to them will definitely boost the confidence of the new couple. So that's what we always do. It's a sort of networking wherein everyone helps each other.
Yeah, correct, ma'am. So I spoke to that couple and she was very helpful. She told me you can contact me anytime, and all the struggles, ma'am, we shared with each other, and she told me you can go ahead, no problem. You will definitely cure this condition.
She's now 7 months
Yeah,
pregnant.
she's 7 months pregnant. When I spoke to her also, she was carrying. So I felt very happy. And she told me, like, you can call me anytime. There is no problem. If I'm not able to receive the call, just leave me a text message. So that was very helpful and very kind of them, ma'am.
I'm sure that you will also do the same thing.
Yeah, definitely, ma'am, definitely. And then, like, we spoke to you, ma'am. And then, as everybody know, like, immediately we can't come to the hospital because previous people, they have taken the consultation. So we
have got a rather long waiting list, you know.
So by March, ma'am, March was the batch which we were allotted, and by March 14, 2024, we came to the hospital. That was the day we stepped into the hospital. By March 15th, ma'am started the treatment.
We can talk in detail about your experiences in this hospital. But in one word, if you can say something about the treatment in this hospital, please say that.
One word, it's a holistic approach. That's the only word which is very much apt.
Did the treatment here meet your expectations? Did it go beyond your expectations, or was it not up to your expectations?
It was beyond my expectation.
In what all way?
In every way, because here when we come for treatment, it's not only the vaginismus condition is considered, but whatever issues we have in our family life. Every time it's not like we love each other, but there is a lot of conflict happening, and then a lot of issues, ma'am. There will be understanding issues, like many things will happen, right? So how to lead a happy life with all the problems, how to tackle the problems. So everything was taught here. So a lot of knowledge we gained from the sessions, ma'am.
Yeah. So what all were you taught here?
We were taught a lot of exercise were taught, ma'am. Then breathing techniques were taught. Then sensate focus therapy was taught. And then we had interactive group sessions, a lot of communication, life skills. All this were combined together in a nutshell, and we learned many things from this hospital and the treatment, ma'am. The most effective was the group sessions, ma'am. Group sessions.
So do you think that there is a difference in the success rate when you take online consultations, or when you go to the doctor once a month, or once in 2 months, or even once in 2 weeks, and admission treatment?
Okay. I feel
because you have undergone both treatment, right? For 6 months you have undergone online sessions with a very good doctor.
Yes, ma'am.
And for 15 days you have undergone treatment with me as an inpatient.
Correct.
On an inpatient basis.
Correct.
So what differences do you feel?
When we take online consultation, there will be a break. We can't continue with the exercise and all. But when we come here, take admission and take the treatment in the hospital, the benefit which we gain is like every day, a part of life, we do all the activities. Whatever is taught on a daily basis, we do it, and the result is very quick and fast. So that's the best thing, ma'am.
Yes. Along with that, the concept of batch therapy.
Yeah.
That is something which is very unique, which we have developed over the past 2 years. The positive energy of the whole group influences each and every member of the group.
Yeah.
Usually we have batches of 4 couples, 5 couples, 6, maximum 7 couples. Only once it went up to 9 couples. My God, it was very difficult for me to manage 9 couples.
As you told, it's a group, right, ma'am? So the thing is, like, we can communicate with each other. In the initial days, I think not initial days, 1 or 2 days will feel a bit shy. Later on, we all communicate with each other. And there is a lot of benefit because as it's a networking and we all have a similar goal. We need to overcome this issue. Moreover, we need to improve our life. How can we improve our life? What all skills can be, can be learned, and we can take the initiative and go ahead with the life. Okay, so everything is taught, ma'am. So we're very happy. So group session is very effective, and I think this is the main reason the treatment is having so much of success rate.
Yeah. The treatment is 10% successful,
correct.
100% successful.
Yeah.
Okay, in all ways. Sexual intimacy is not a standalone intimacy. Unless you can have intimacy in other areas or at other levels, it's not possible to enjoy sexual activity, right? Maybe you can just do it for namesake, but you cannot enjoy it. So that's what we teach people here. And by the time the couples leave here, they have this feeling, they go with the feeling that having developed vaginismus is one of the best things that have ever happened in their life. Because of that, they are able to learn so many things. Do you feel like that?
Sure, ma'am, 100% that's true. There is in the teaching process, mindfulness is taught to us. So mindfulness, it's like whatever we do, okay, anything, whatever we do in the daily life, we should be mindful. The thing is, like, put your mind, body and soul, so definitely you'll have success rate. So a lot of things we have learned from here, ma'am. One day you need to achieve everything, it's not possible. A tiny step, step by step, it's very effective.
That is, we achieve tangible goals once in 2 days.
2 days, yeah, correct, ma'am. So that has helped us a lot. I'm sure every couple, whoever has taken the treatment over here, they all will tell this, it's very effective. So that has helped us in many ways.
No, it's not that you're closer to the hospital. You are given the liberty. You have the freedom to go outside. You have the freedom to go to see movies. You have the freedom to go to temples, churches, or wherever you want. And all the couples actually go together. After the initial 1 or 2 days, they don't like to go alone. All of them go together. Okay. And there is group interaction when they are having food together. And then we have beach therapy, which is a very unique therapy, So we will not divulge more about it now.
Yes, ma'am. Correct. So the main thing is, like, as ma'am told, the atmosphere created here is, it's like always positive. So we enjoy. And I really want to say one more thing. Yoga is very mandate in this treatment. So every day we'll have yoga sessions morning. So our mind, body get relaxed. That's very helpful. So when we begin a new day, a fresh start with yoga, it's very, very wonderful.
And how did your foreplay improve after coming here?
That was like, I have no words, ma'am, because I thought penetrative sex is the only part where we can have so much of pleasure, but I was wrong. I understood that a foreplay is something which we need to take more time and enjoy, and penetrative sex is a small part of it. That's
it's just like having a dessert after a main course.
Correct, ma'am. So we understood the importance of foreplay and how we need to do that. Everything is taught here.
Did you lose your inhibitions to talk about sex and sex-related things?
Ma'am. I think even you are aware of it, because in the beginning, first or second day, we were like, how can we discuss about this topic? About sexual life, how can we discuss to an unknown person? Second day, we were like, we talked to them and we asked, how is it, how you're feeling? We use a very good language and we communicate with all the couples, and it's very good, we can discuss.
That will help you a lot in the future also, because when you have children and when it's time for you to impart sexual education to them, it will be very useful.
So the treatment went very well. What I would like to tell is, like, the decision which we have taken together, me and my husband, to come to the hospital. So I'm very happy that 14th or 15th day, along with all the treatment, we were able to go ahead with the penetrative sex.
You were able to consummate
the marriage. So ma'am told, after the beach therapy and all, ma'am told us you can go ahead with the next procedure. So once when we came and tried, we were not able to do it. So we were a bit, unhappy. What happened? Everything was going smooth and fine. And then ma'am just came and spoke to us, and whatever was taught, all the skills was taught to us. We started doing all those things, and
That grounding technique helped a lot,
yeah,
I suppose.
grounding technique, yeah. And by 15th day we were able to consummate the marriage, which I can tell it is a biggest miracle in our life, because 5 years of marriage we're unable to have penetrative sex. So we are very blessed that the techniques and the teaching, everything has helped us. Ma'am, sir, and the complete staff was very cooperative. That's a reason. It's a teamwork, and that's the reason we have achieved our goal. That's what I can say.
Good. And it's extremely nice of you to volunteer to create a public video in order to spread awareness.
Yes, ma'am.
I'm really thankful. And I'm sure that the viewers out there will also be very, very thankful.
Yeah. Even I'm very thankful to ma'am, Dr. Sita ma'am, because I was not like this, the person you see in the video. Okay, I was completely shattered when I came here. So I feel, I feel so happy to be a part of this video. Ma'am has given me an opportunity, so I'm so happy. And I would like to conclude saying that it's like a mother and child relationship. I'm very happy, and she's an angel. So you're in the safer hands, okay? So we all reached in the safer hands, and we're very happy. So today we are returning back to Bangalore with so much of happiness. We are gonna start a fresh life, and it's just wow. And so I'm so thankful, ma'am. Thank you so much, ma'am. Complete team. Really hats off to them, for the effort they put in, to make this treatment a wonderful success. Thank you, ma'am.
It's
Thank
our
you so
pleasure.
much.
It's our
Yeah.
pleasure. And such validation really helps us a lot. It
Yeah,
boosts
ma'am.
our confidence
Yeah.
also.
Also, I wish that everyone is aware of this, and anyone watching this video, kindly share it. It will definitely help your sisters or your friends, anybody. So, and we pray that everyone have a happy, peaceful life. Stay blessed. God bless each and every one of us. Thank you. Thank you so much.
Bye-bye.
Bye.
Take care.
Take care.
Till I see you with another video, stay blessed.
Yeah.